Hello everyone, in this video we're going to be discussing squamous cell carcinoma of the lung. Now, squamous cell carcinoma of the lung is going to be found in smokers. It is going to be associated with the tumor markers C5, C6, P40, and P63. It is going to be located centrally, and when I say that, here I've drawn a picture that is going to represent the lung, and here we see the cancer cells that are going to be proliferating in the bronchi. So they're going to be located centrally in the lung. So they're not going to be found over here, for example, and we would call that a peripheral tumor. So because these cells, these cancer cells are proliferating in the bronchi, they're going to make it hard for the air to get in and out. As a result, this can sometimes cause shortness of breath for the patient. And because these cancer cells are growing rapidly and proliferating, they can also cause inflammation. And with inflammation, what can happen is there can sometimes be bleeding and patients can cough up blood. And that's called hemoptysis, which can be a clinical finding. And because cancer cells are going to be foreign to the body, it can also trigger the cough reflex and can cause a cough. And now, again, because the cancer cells are blocking air from getting in and out, it is going to require the person to have or spend more energy to breathe. As a result, it can cause weight loss because now they're spending more energy trying to breathe in and out. And it is all due to the fact that there are cancer cells that is blocking that passageway. Now, histologically, squamous cell carcinoma can present with keratin pearls, and it can also present with intercellular desmosomes, also called intercellular bridges. So here, in this histological slide, is going to be keratin pearls. And as you can see, there's a lot of eosinophilic infiltrates in this histological slide. And here, what we see is intercellular desmosomes or bridges. And so this is going to be found on the cells, and it is going to be close to the adjacent cell. So these are going to be really close to the adjacent cell. And here is another histological slide that is really showing these intercellular desmosomes, also called intercellular bridges. Now, squamous cell carcinoma is going to be associated with cavitation that is going to be extending to the hilum. Cavitation simply means cancer cells eating away the lung tissue. And cancer cells are also going to be excreting something called the parathyroid hormone-related protein. And this parathyroid hormone-related protein, just like parathyroid hormone, can cause the body's levels of calcium to rise. And because calcium levels can rise, patients can present with signs of hypercalcemia, which can include tetany, seizures, QT shortening, as well as twitching.